Hello and welcome. This is Dr. Jeff Angobaldo, a board certified plastic surgeon, otherwise known as Dr. Plano. And we're here with our next series episode of our podcast. This one will be focused on is liposuction. Liposuction hasn't changed too much over the years. One of the techniques that we use is just handheld cannulas. It's been around for 30 years. And we've kind of gravitated away from that into other modalities and techniques that help us with liposuction. And one of the most popular ones is called the physician-assisted liposuction tool. It's called the PALS. Other modalities include laser lipo, the radio frequency ultrasound, such as the Vasor. So there's been other modalities out there, but I think the best for me personally is the more consistent result that a surgeon has is the modality that you use. And for us, it's using the PALS system. So who are good candidates for liposuction? It's patients that take care of themselves. They're happy or ideal weight, just have some problematic areas. They work out. And because you don't want anyone to gain weight after liposuction. So we tell all of our patients, they have to be health conscious, they have to eat well, they don't smoke, and they're going to be good candidates for this procedure for longevity. Because what happens is, let's say for liposuction, someone's flanks, and that's an area that usually will get full with weight gain. And so if someone gains weight, most of the time it's not going to go to those areas that were liposuction. It can go to other areas, such as, it can go to everywhere, the face. A lot of times, men, especially men, and for some females, people can accumulate fat in the visceral cavity where your guts are located. And that is not the best place to accumulate fats. We call it the beer belly, and it has nothing to do with drinking beer, just overconsumption of carbs. But if you're gaining weight in that area, it's not very healthy long term. People get fatty livers. It's not the best way to gain weight. And the only way to get rid of visceral fullness is diet and exercise. So be careful not to gain too much weight after liposuction because it could end up in the visceral cavity. The techniques haven't really changed too much. In general, for every area of the body, you want to leave a little bit of fat to prevent deformities. So when we're liposuctioning, we're always pinching the skin. And we always want to leave, at least for the abdomen and back, 1 centimeter of fat. A homogeneous carpet of fat, you could say. And if you do it a little bit less in those areas, you can have deformities or cannula marks that are very hard to fix. When you're looking at areas like the neck, we're leaving about 0.5 centimeter of fats. So every area usually is a little bit different with how much fat we're leaving. But the majority of areas, the abdomen, the back, the more common areas, we leave a carpet, 1 centimeter of fat for good results. One thing that's changed with our liposuction procedures over the last 10 years, I started doing some etching. So we're kind of over lipoing the abdomen around the rectus abdominis muscles to really accentuate a more physically active appearance, the appearance of a six-pack for a male, for example. And so we basically over lipo these areas, leaving 0.5 centimeter of fat, creating deformities, but they're deformities that are around the muscles and they look really athletic. And that's one of the techniques that we've changed over the last 8 years for better results. We're always evolving our techniques in plastic surgery. I mean, how else can you change and provide better results in the future? As you can see in this one particular patient, she's got some volume around, these are the flanks on the sides. That's the anterior flank, and by the lower back is the posterior flanks. This is her abdomen. There's not much definition. And she's in pretty good shape. And as you can see afterwards, she has a really nice change in her silhouettes, and she has the appearance of an athletic abdomen, which is very hard to do because you have to eat well, you have to work out consistently, and not all of us have time. I certainly don't, because of the workload and because of children. To really have a nice athletic look, you have to do a lot of different, it's a big sacrifice. You gotta go to the gym, you have to eat well. Some of the more common complications of liposuction includes bruising and swelling. That will occur in the first 7 to 10 days. And that's normal. But another complication is the hematoma, or a collection of blood that can occur. That doesn't happen very often. What's more common is a seroma. A seroma is an active fluid collection, and that usually is caused by too much activity by the patient and not using the compression garment that's provided by them by their surgeon. So, when you're liposuction, you're disrupting a lot of stuff below the skin, the lymphatics, arteries, veins, you're removing fat. So you have a lot of like empty spaces. And it takes a good week to 3 weeks for all that skin to adhere back to your abdominal wall. And if you're too active, that fluid, that skin and fatty tissue that's remaining is moving. And that constant moving generates fluid that your body can absorb. But over a certain amount, it can't. And that's a seroma. And how do you take care of a seroma? We tell our patients, if it's a mild seroma, minimize activities and wear your compression garment. If it's a large seroma that you can feel, we usually aspirate it with a needle and a large syringe. And the instructions are always the same: minimize activities and use a compression garments. Other complications that can occur, there's always, with any surgery, infection. There's also numbness that can occur. Because you're liposuction, there's nerves below the skin, and you can be numb in certain areas. A lot of times that's a transient process, and after a couple of weeks, it comes back. You may have some numbness around the liposuction areas. Asymmetries and contour irregularities can occur. And that means, let's say after a couple of weeks, you're feeling more fullness on one side than the other. That's a contour irregularity. I always tell our patients wait 6 months, because really, truly, liposuction takes 6 months for final results. And so once there's some fullness in one side compared to the other, that can easily be addressed with some liposuction if needed. It doesn't happen very often. As you can see in her oblique view, it's a very smooth result, very nice athletic lines. And, for every patient, it's a very satisfying surgery because patients are very happy, especially with their results, especially creating a little definition because they can go to the pool or the beach and they look athletic. There's some real serious complications and risks with these surgeries. You can liposuction and you can penetrate the fascia going into the organs, and that could be life-threatening. There's also risks of getting into, I guess, the lungs or the hearts. That can go anywhere. So it's always good to, complications do happen, but it's always important, just like the board-certified plastic surgeon. This next patient is 6 months out, and she looks great. And very good definition, very good tone to her abdomen. It is hard to do on your own unless you eat incredibly well and exercise 3 or 4 hours a day. Men are treated a little bit differently. The liposuction in men, we actually create little boxes along their six-pack. Believe it or not, the rectus abdominis muscle, actually they call it a six-pack, but it's actually 3 separate muscles that comprise the rectus abdominis muscle. And there are actually separations between these little muscle bellies. So these separations is where we actually over lipo those areas to heighten the six-pack appearance. So for men, it requires an extra incision, and we create horizontal lines. So for females, they're more vertical lines. And for males, we do the verticals and the horizontals. It actually looks really good and very athletic after their 6 months. You can start seeing these results as early as 6 weeks. I always tell our patients at 6 weeks, you're at almost like 60% of your final result with lipo. That's when things start just looking good. But there's always areas that are a little bit hard, swollen. There's all these little irregularities that take more time to go away. And that's where lymphatic massages really help. Wearing a faja or a compression garment, getting early lymphatic massages truly help the swelling, help some of those hard areas go away and dissipate a lot faster. Now, if a female wants the horizontal lines to create a six-pack appearance, that's not a problem. But a lot of them, the majority of our female patients just want the vertical lines. They think the squares look a little bit too masculine. So, It all depends on what they want and what we can achieve. One of my favorite areas of liposuction is the back because of the change in the torso. And it's such a powerful area to lipo to really change the entire shape of someone. The back consists of like the upper, the middle back, which is that bra roll area when patients are wearing bras, that little fold of skin and fatty tissue that kind of bulges below it, and then the lower back and the flanks. So these are the areas that are liposuction. As you can see in this before and after, it's a very smooth contour compared to what it was before. This patient is about 6 months out. You can see a lot more muscular definition. You can see in this after picture, the six pack has a rectus abdominis muscle. In the back, you can start seeing the paraspinous muscles afterwards. It creates a very nice athletic results in someone's back. It changes the shape of someone with the liposuction. It's a really powerful tool. It's my favorite area of lipo is someone's back. One of the most popular areas of lipo is the arms. And so for a lot of female patients, they're very self-conscious about their arms. They don't like wearing, summer, spring t-shirts where it exposes the fullness in the upper arms. So they try to hide that a lot. So one of the most gratifying surgeries to perform is liposuction of the arm. Creates a really nice shape and it really gets rid of that volume. And what's really nice is that I also changed my techniques and evolved over the years. About 12 years ago, most people just lipo the lower part of the arm. That's where the lower part is what people are more self-conscious about. But I noticed in fuller patients that they had some volume and extra fat around the lateral part of the arm. So I started lipoing that part also. And it really creates a really nice definition on someone's like deltoid and triceps. They look a little athletic. It looks really good. So about 12 years ago, we changed and evolved our techniques to lipo not just the bottom part, the posterior aspect of the arm, but also the lateral for much better results. This is the before and after, someone with a fuller arm. But what's key, who are good candidates, are people with good skin tone. It's hard to liposuction someone that has loose skin, whether it be someone's arm or someone's belly. If someone has 4 kids or lost over 100 pounds, they're probably not going to be great candidates for liposuction. So who's a good candidate? Someone that watches their weight, someone that's in their happy weights, their ideal weight is what we call it, and someone that also is realistic with their expectations. And that's what's key. But if someone has loose skin and they're better treated for better results with a tummy tuck or arm lift surgery for loose skin around the proximal arms, then that's the route that we'll choose. That's why the consultation is key for any patient. Always consult with a board-certified plastic surgeon that does a lot of these surgeries. That's what's really important, someone that has a lot more volume and experience. The surgical consultation is key because we can really examine the skin tone to really see if someone's more of a candidate for liposuction versus lipo and a skin excision. So we've done a lot of Zoom consults, and that's great, but it's not the same. You want someone in the exam room. You want to actually feel the stretch of the skin and the tone to see if they're good candidates for liposuction. Obviously, people that don't smoke is key. So if you want good results with any of our cosmetic surgeries, you don't want to smoke. And you can see here in this view where lipoing the posterior aspect of the arm, really accentuating the deltoid and some of the triceps muscles. Post-op care with liposuction entails, there's going to be using a compression garments. We usually recommend using one for 6 weeks, but a lot of our patients will also recommend using it for much longer periods of time because they swell. You start working out at 4 to 5 weeks, you'll notice you swell. People don't look very attractive. So we always recommend, if you're able to, use compression garments for your entire recovery process, 4 to 6 months. We also recommend massages. Lymphatic massages work very well to decrease some of the lymphedema, the heart areas that can occur, and the irregularities of liposuction. So going to a good massage service is also key for good results and preventing fibrosis that can occur later than 6 months afterwards. Liposuction is is probably the most popular procedure that's performed in the country, and it has a very high patient satisfaction rates. But always, the most successful results are the patients that follow their doctor's instructions. And one doctor might be a little different than another, but as long as you just follow their recommendations, then you'll have a successful results. And always choose a board certified plastic surgeon. There are a lot of different modalities to help a surgeon perform liposuction. I kind of mentioned it a little bit earlier. We use the PALS system. There's also the Vaser, there's laser lipo, and there's different names for different laser lipo machines. And I was a big proponent of laser lipo for the first 12 years in practice. And I used it religiously with almost every surgery. I really honestly thought that there was less bruising, pain, swelling, and more skin tightening. And you're seeing the tightening of the skin immediately in the operating room. But one thing I noticed was like 6 months later, they both looked the same, both sides. If we did one with laser and one without, it was the same skin tone. There was an eye-opening study that was done a few years ago in our plastic surgery literature, basically comparing laser lipo versus just traditional liposuction. And they found no change in skin tightening, bruising, or swelling. They did find a little change, less pain in the laser lipo group. So since that study, I stopped using laser lipo. And as we evolve our techniques, and with the more experience we get with surgeries, my results are always getting better and better as the years progress. So initially, I thought it was due to the laser lipo, but really, it's just, I think the key is to use small cannulas, which doesn't disrupt a lot of the fibrous connective tissue. We use cannulas that are 4 millimeters, not big 1 centimeter cannulas. So I think it's just the surgeon's technique and experience that provide the best results versus a machine or a different modality. That's my take on that. Well, this concludes our podcast on liposuction. I hope you learned and hope this was educational. And if keep following us for more educational podcasts and enjoy your day.